So we've been investigating the role of RSK1, RSK1 in myeloproliferative diseases and secondary AML, and we found that this seems to be an exploitable dependency across myeloid neoplasms, so including MPNs as well as other myeloid malignancies, and particularly in the setting of disease progression. Yeah, so we found that both genetic and pharmacologic targeting of RSK1 has been effective in our preclinical models. We utilize animal models such as the Myeloproliferative transplant system, as well as patient-derived xenograft models, and consistently targeting RSK1, for instance, with PMD26, which is an oral kinase inhibitor, has been able to ameliorate disease phenotypes in these settings. Yeah, so the compound PMD26, which is being developed by a company called Phoenix Molecular Designs, has been in development for breast cancer and is currently in a phase 2 study for breast cancer. We've been working closely with Phoenix Molecular Designs, and we're actually on the cusp of initiating an investigator-initiated study in myelofibrosis and other advanced myeloid malignancies with this compound PMD26. So I think it's important to note that, again, this drug is in development in breast cancer. This will be, our study will be the first study to investigate this compound in hematologic malignancies. And so we have some experience to draw on from the breast cancer study, but we'll see how this pans out in this setting.